To the very first episode of the Wood County Recovery Roadmap podcast. My name is Kaylee, and I am thrilled to be able to be your host as we journey through the wonderful world of podcasting together. A little bit of a disclaimer. When I say Wood County, I mean Wood County, Ohio. My deepest apologies to any Wisconsinites that thought that it was your county, but it is in fact Ohio. I host this podcast on behalf of the Wood County Alcohol, Drug Addiction, and Mental Health Services Board. That is indefinitely a mouthful, so now that you know what it stands for, I will usually call us the Wood County ADAMHS Board. If you're familiar with entities like ours, you might have heard it called ADAMHS Boards, but I think that that's a Southern Ohio thing, because up here in Northwest Ohio, we are just called ADAMHS. I'll be sharing a little bit more about myself here in just a little bit, but the true focus of our first episode is what the roles and responsibilities of an ADAMHS board here in the state of Ohio are. I am so excited and grateful to be able to welcome all of my fantastic coworkers to give you a better idea of what we do day to day. Before we jump into today's episode, I want to make sure to share some resources that are available in Wood County 24/7, 365 days a year. First is our very own website, WCADAMH.org. Our website hosts a plethora of information and resource guides on the full continuum of behavioral health care here in Wood County. If you are in need of immediate crisis care, the following are some numbers that I always recommend adding to your phone. As always, if you are in need of immediate medical attention, dial 911. If you or a loved one are over the age of 18 and in a behavioral health crisis, dial the Wood County Crisis Line, managed by our partner, Unison Health, at 419-502-HOPE or 419-502-4673. If you or a loved one are below the age of 17 and in a behavioral health crisis, contact the crisis line managed by our partner, the Children's Resource Center, at 419-352-7588. The National Suicide Prevention Lifeline just fully transitioned to their new number, 988. If you prefer to text, you can text the number 4 and the word HOPE to 741-741 to be connected to a crisis text line counselor. With that being said, let's head into our podcast. So I am here now with Miss Amanda Kern. I always want to call you Dr. Kern because that's like an inside joke in the office. Not Dr. Degreed. No. But you are our fearless leader. I just called Amy the captain of prevention, so I'm not sure what that makes you in terms of our office. But you are our executive director, our brand new executive director. Can you tell me what that means? That isn't, I do all of the things all of the time.
That was my answer, though. My job is to administratively run the office, meaning I supervise everybody, I make sure all of our policies and procedures are up to date, I make sure we're working towards the projects we've identified to, I do a lot with community relationships and community education, and then it's my job to liaison between us and our board of trustees. So they are my oversight committee who watch over the job that I'm doing and make sure that I'm executing all their contracts and all of their orders and resolutions appropriately.
You know, what's super fun about that answer is that you told me all of the things you do, which you do. But now I have to talk to all our coworkers, all of the people you manage, about how we do those things. So you have this very I manage that. And then I'm like, oh, they don't know what that even means just yet.
That'll be great. You have to listen to everybody talk. It doesn't make sense right now.
Right. I know that every interview you've ever done, they're like, let's talk about your past. So I will say, if you want an in-depth knowledge of where Amanda came from, you can listen to any of the interviews that she's ever done. But I want to talk to you a little bit about how that plays into your role now, because you've been with us now for just about 8 months? 9 months?
9 months? It'll be a year in March.
So you came from one of our providers. Mm-hmm. So you have this really interesting perspective about how we do from an administrative standpoint, but also maybe being a little curious from the other side about the decisions that we make as the board. So can you tell me how that kind of dual perspective has taken you through the last 9 months on the other side, if I can call it that?
It's been interesting. I tell everyone it is a little bit like being in a foreign country with a language you don't speak, because as providers, we've had our own language. We've had how we bill, how we manage clients, the models we use, all the things that I have lived and breathed in for my entire career, and then switching into government functioning, which was really different, very different. And so it was a learning curve, but it also, I think, is really helpful because I really can empathize and have a lot of understanding for a lot of our providers' perspectives. So whenever we're talking about contracts, we're talking about programs, we're talking about outcomes, those are things that I feel like I can really connect to. Mm-hmm. And especially the workforce shortage, it still lives like it was yesterday for me, of how are we going to cover this, how are we going to make sure these things function. So that it helps from that perspective, but then there's so much about, as a board executive director now, I wish I knew as a provider about what boards do. And so it also gives me some insight into how can I help educate other people on what we do, because I didn't know all the things that we did. Even when I applied for this job, I was quite surprised by some of the things that we do and the tasks we have in our relationship with the state and the amount of reporting that goes back and forth. So I'm hoping that helps me bridge that gap a little bit so people can really get a better understanding about who we are and what we do.
And that was like such a beautiful answer, and I don't know what I was expecting, but
you were waiting for me to be like, it was okay.
No, I think that my marketing brain, and I'm going to leave this into the podcast because this is really how Amanda and I talk to each other. Mm-hmm. But my marketing brain, as you're talking, is like, so she's telling the providers to listen to the podcast. And that just stuck into If you want to know about what we do, listen to the podcast.
Yes. But also, I know we've talked a lot internally about doing trainings, like ADAMHS 101 trainings, so people can see and hear from us and ask questions to us. And I'd love to be able to replicate what some other communities do and provide that to frontline workers. Mm-hmm. So it's not just executive teams know what we do, but that the case manager going into the client's home knows we're a resource and knows what our function is. So my goal is, yes, that everyone will listen to the podcast, but also that I can continue taking this further and further.
For sure.
To where it's very transparent. People know what's happening here, day in, day out.
So you kind of alluded to maybe the crust of the earth as far as what we've got going on in this office. I feel like trainings are really the bottom of all of the programs that we have going on right now. So I was wondering if you could just talk to us a little bit about maybe all of the things that we have in the fire and how you as the executive director determine that this is something that we're going to follow through on, or I know that's like a huge question because there's so many things happening, but really if you could just give an inside look kind of behind the curtain, if you will.
Okay. Great and powerful Oz moment here.
Yes.
Like you see the machine as it's operating.
Yes.
So we have a few things that I think are important to highlight. One is the marketing efforts. I think people are seeing us now thanks to you. And so that is a huge effort that we're doing as a business and agency to get people, again, just to know who we are and recognize us when we're out in the community, our logo, our messaging, and recognize our providers, so that we're really extending that hand even further past what we're providing. And really it's about what are they doing, because that's what we're here to do, is lift them up. I think the other things that we're working on right now, we're doing a lot of administrative work. So if anybody's talked to me in real life, they know that that's what we're spending a lot of our time, because we're seeking certification. It's called Culture of Quality, and so it's our goal to be a certified Culture of Quality board, meaning we're functioning within all of the parameters of all of our legal requirements, and being monitored by another group that says, yes, you're doing a great job at doing that. The other pieces that we're really focused on right now is we've been doing some prevention work, because the prevention rules are changes. So I'm sure Amy has talked about it. We'll continue to talk about it. We'll keep giving updates to the community. We're doing a lot with our youth system and their crisis services. And then we also have been doing a lot with youth who may engage in targeted violence. So a lot of youth initiatives. And so really when I came into the board, that was my question, was how do we determine what it is we work on? Because there's so much to work on in a community, and especially a community as large as ours. And so we have really, or as an executive director, I have really pushed to, we're going to do things within our community plan that is developed directly from the feedback we get from our providers, from the community, from our stakeholders, that says these are your areas of need. And then we also will be using our strategic plan that's in development to say, here's really what our priorities are. Now, that's not to say that it couldn't miss something, because I'm sure we can miss things, but by and large, it will be that we're working on things that are between one of those two plans. So.
And you can find our CAP, actually, on our website.
Yep.
So if you are at all interested in the priorities that Amanda is discussing, we really try to be forward-facing. I and someone you'll meet later, I think, Catherine, our executive assistant, she and I have put a lot of time into our website to make it more forward-facing. So most of the things that Amanda is talking about is available there. So you did kind of steal one of my questions about we are doing administrative work here, which is great, brilliant. But I do want to end on kind of a fun note and ask you if you had a hypothetical autobiography, what the title of it would be.
So, not to kill the magic here, but I knew this question was coming. And so I thought a lot about it because all of my answers were sarcastic. And it took me about 14 answers of sarcasm to get to one I think that is meaningful. So one of my favorite songs is Bluebird. I don't know if you've heard it, but one of my favorite lines from those songs, and life keeps serving me lemons, just mix them in my drink. And so I think that would be the title to my autobiography. Life served me a handful of lemons, probably a bucket full at a certain point, and I'm real good at making lemonade out of it. So I think if there was ever a reason anybody would want to read about my life, I can't imagine why, that would be a great kind of summary of here's everything you're about to walk through in this book.
You are my second answer. Again, taking the magic out of it, I don't know where the interviews are going to fall, but I can't wait to hear everybody's answer to this specific question. And probably when we turn the microphone off, I will be beating down your door to know the other 13 above this answer. But I do just want to take the time to say thank you for hanging out with me today and giving, the people a very Oz look at what the board does, because I think that really you hit the nail on the head where you're talking about, obviously you're the executive director, so we're kind of abiding by. But I think that we've really been missing this piece of how does the board function? What even is a board if you don't know? So really I just want to thank you for hanging out with me and giving good information and being a fantastic segue into all your staff.
Thank you so much.
So I am here with Amy Coe.
Good morning.
Good morning, good afternoon. I don't know when this is going to go out, but when you're listening to it, have a good one. So Amy is our director of community programs here at the Wood County ADAMHS Board. So can you just give the people a very broad definition of what you do? And you can't say you do all the things, because I know we all want to say that.
I do all the things. Oh, okay. So, I do a few things. One of the things that is official on my job is being the Client's Rights Officer, or the CRO. So, I take any complaints or official grievances that clients may have against our agency's concerns, and I help investigate those and present a resolution. There's very specific things in statute that I have to do for that. So that's a piece of my job. Sometimes that keeps me really busy. Other times it's kind of feast or famine. So it just depends. Oh, wait, you probably want to know what else I do. That's not all of it for sure. So I'm one of the 3 clinical individuals in our office. So my expertise, although I'm licensed in mental health, I spent a lot of time doing substance abuse counseling. So I'm kind of looked to for expertise when it comes to that. So as far as clinical stuff, it can be anything from looking at allocations and making sure programming sounds good to coming up to new ideas, such as, the vending machines and kind of bringing that to fruition. We have a new idea that we put in our SOS programming, which is the Leave It Behind program. So once we get that officially a go, I'll be working on getting that out to our paramedics and firefighters to get that distributed within our community. So I'm kind of an idea person when it comes to the substance abuse stuff. I mentioned SOS, so that is the state opioid stimulant grant. I, along with Julie Lonstein here in our office, head that up from a programming aspect. And every year we apply. This year it was 17 different programs, so I kind of vet all those different programs and make sure that works together in one application. So it's a good couple of months out of my job there that I spend doing that. So, and then the other things that I really do are our prevention aspects. So like our coalitions, our Suicide Prevention Coalition, as well as the Addiction Task Force and the Prevention Coalition. I play varying roles on all of those, and work on having events in the community that benefit everyone in regards to prevention. So that's kind of, I'm probably going to more, but that's in general kind of what I do.
Yeah, so I was going to say, I told you that you couldn't say I do all the things, but basically you said I do all the things.
I do all different things.
And you briefly mentioned it when you were talking about how you head up our coalitions. And I do want to mention that you are super important to both coalitions, which I think you kind of alluded to.
You.
But so you are the chair of the Suicide Prevention Coalition, and you are the vice president of the Prevention Coalition, which meets with the Addiction Task Force.
Correct.
So I just want to dispel any rumors that our listeners might have that you have left the board, because you are still very much here. But you are the VP over there too.
Yeah, I got a few congratulations. The I think it was an article went out. Mm-hmm. Oh, congratulations on your new position. That is a non-paying position, so no, I did not leave.
And we're happy to have you, obviously. I was a little surprised to hear the congratulations, too. But talking about the Suicide Prevention Coalition and the Addiction Task Force, you are right now getting prevention certified. You're working your way through that process.
Yes.
So can you tell us a little bit about it and how you think it will benefit our coalitions and our board and all that stuff?
Yeah, so right now the prevention certification is through the Ohio Chemical Dependency Professionals Board. I think that's going to be a move here soon, but that's neither here nor there. But right now I am a registered applicant, which means I am working on my hours for prevention, as well as all the trainings that are required. So my hope is to be prevention certified within the next year, and my hopes and dreams behind all that. There are some changes in the prevention rules that are coming up in 2025, so I want to make sure that we're getting ahead of that. But ultimately, I'm trying to professionalize, if that's a word, everything that we do in prevention, making sure that it fits the prevention strategic prevention framework model that SAMHSA has, making sure that everything has a purpose and it is evidence-based. Because it's really easy to call a lot of things prevention that aren't necessarily prevention. So we're hoping that my prevention certification will really take that in that direction.
Oh, I cannot wait. As someone that I know that the podcast listeners are just going to get little snippets of it, but I actually get to watch you walk through the process, which is super exciting. So what I'm saying is I'm going to talk about this all the time on the podcast.
That'll be real exciting and riveting.
So first, I want to ask if you can tell us just kind of a 50,000-foot view of, we'll go through both, but let's talk about the Addiction Task Force first. So can you just tell me what it is, what it does?
Yeah, so the Addiction Task Force, by statute several years ago, was required by all ADAMHS boards. Actually, it was an opiate task force that we are required by law to have and report out to. Now, throughout the state, many ADAMHS boards have kind of shifted how they do this. Some have actually are not doing it. I was actually shocked by that because it is in statute. But ours has shifted to take not only a view on opiates, but a view on all substances. So we changed names from the Opiate Task Force to the Addiction Task Force a couple of years ago. And then when the pandemic hit, we kind of felt a lot of what we did overlapped with the prevention education that's going on in the county. So I kind of married those two with Tina Bradley and Kyle Clark from the ESC. So our addiction task force meets in conjunction with the Prevention Coalition, and it seems to work out really, really well. They have a grant and certain activities that they have to do for that grant, and it definitely works with all the activities that we want to do with the addiction task force. So, because prevention and substance abuse treatment they all go together.
Mm-hmm. And these meetings are open to the public, right?
They are open to the public. So they are held on a quarterly basis. You can contact myself or Tina Bradley, and we can get you on the email. They're at the ESC usually on a Friday at 9 a.m. And they go until about 10:30, and we have a variety of topics that we cover. So we try to keep it interesting each time so nobody's bored. So we bring in speakers and have different updates and make sure that everybody is knows what's going on in the county.
Mm-hmm. I've been there. I love them. One time, I will say, our office brought snow cones after the Prevention Coalition meeting.
Yep.
So if you're interested in some surprises and learning about the countywide addiction response, I would highly recommend these meetings. And maybe I'm a little biased because, they'll find out. But the Suicide Prevention Coalition, which is a big part of our community. You are the chair of that. This has been your thing for a while. So can you talk a little bit about what the Suicide Prevention Coalition is and what it's become and kind of where it's going? So same question, but different coalition.
Yeah. So the Suicide Prevention Coalition has been around a long time. I honestly couldn't even tell you when it started. It predates me. I was on the coalition prior to working here, which was... I started in January of 2018, and I was coming to coalition meetings probably since 2014. So it's been a minute. So we've been around for quite a while. It's definitely taken a different shape in the last year or so. So I view myself as the kind of captain steering the ship, but I don't necessarily have to have my fingers in everything, which seems to be working out really, really well. So we have our overall coalition, and we just meet quarterly, and that is just kind of keeping everyone updated and kind of keeping everyone on the same page. And then we have multiple subcommittees, and all those subcommittees, I try to get to as many of those as I possibly can, but they all have different age groups that they kind of target. So some target really young kids like you are the go-to person for the kids subcommittee. Are we calling you chair? Yeah.
I think.
Okay, all right. I was like,
that's what makes me feel like the most
we call
cool.
You captain if that makes you feel better. I don't
know what the ship ranking is, but if you're the captain, I'm like, I don't know.
I know. I have to look up like naval. I don't know what that is, but yes. So we have the kids all the way to a postvention committee, and that really looks at what can we do after a suicide death has occurred. So we have those committees that meet. Most of them meet monthly. Kind of depends on what their needs are and what's going on, and they all have activities and budgets and everything that they keep track of, and I'm just kind of overseeing all of that and making sure it's meeting kind of what our goals are for the coalition overall. So we always need more volunteers, if I can't say that out loud, because that is a big thing. We want community members involved in this because that is kind of the heart of what we do.
Absolutely. So I won't ask you about it too much because we have things in the works that we'll talk about in a later episode. But you and I get to work together a lot with the Suicide Prevention Coalition. Yeah. So you are also the captain, and whatever's below the captain.
I don't know.
because we have a brand new adult subcommittee this year, which you are the chair of. So we have a lot to talk about in a future episode, but I'm really excited to dig more into what we do and how people can get involved. But the one thing I do want to make sure that I mention is that the Suicide Prevention Coalition does have a website. It's woodcountysuicideprevention.org, and you can find Amy's contact information on there, information about the meetings. As Amy said, they're held quarterly. You can find the address for the Nami Wood County office where we meet. Sign up for our newsletter. Amy does the most beautiful job on newsletters quarterly.
Thank you. I am not as good as Kaylee at this stuff, but I am trying.
It's informative. It talks about things about the coalition. So really, if you're involved in the heart of the community, I really like how you said that. Preventing suicide, keeping people alive, I would really recommend joining our coalition.
Yes. And I'd love to send you out my newsletter. So I keep a close eye on the analytics, and I get excited when people look at it.
So I want to go back to something you said a little bit earlier where you said sometimes we call things prevention, but they don't really fall in line with what prevention is. And I totally get that because the language, I've learned so much about the language we use in my tenure here. So I wondered if you could talk just a little bit about what prevention actually looks like in the county and how it meets those SAMHSA requirements and kind of some of the things you touched on before in professionalism. So if you could just give me, I know that's like a huge question.
It is a huge question. So I'm going to veer just a little bit off and tell you what I'm doing because I think this will really help. So I am currently collecting survey data on many of our partners that also do prevention work. So I'm really trying to get a handle on what is it that everyone does, because I think in some ways a lot of agencies will tell you we do prevention work. And so we want to know what those efforts are, what they look like, how are those funded. So I'm really trying to take a deep dive into not only what we do as prevention, but what does everyone in the county do that's prevention. And my goal is to kind of get us all on the same page, all rowing in the same direction. That we're keeping the ship theme, okay? So, I have gotten, I think, 6 responses back at this point. I have a few more from our agencies that I'm looking for, so I've sent out reminders. And once I get those back, I think I'll have a better picture of kind of what everyone does. Because there's lots of stuff that's also prevention that isn't necessarily in our purview. So child abuse prevention, of course, that's really important, and that does run alongside mental health, but it's not necessarily directly related to what we do on a day in and day out basis. But I want to know, what are those prevention activities that are going on in the county? So what I'm going to be looking at those things in the purview, but also the things that are directly important to substance abuse and mental health prevention, especially suicide. So hopefully that answers your question. I know I started it with saying I have a little update. So that's my update.
No, that's fantastic. So I want to thank you for all of the information that you gave us. It was really helpful. And you'll be back to talk about the Suicide Prevention Coalition.
Of course. Anytime.
But I do want to end with a bit of an icebreaker type question so people can get to know you as Amy, as well as Amy, the doer of all things. So if you had an autobiography of your life, what would the title be?
Okay, so I had to think really long and hard about this. So I put a lot of effort, and probably most people will have no clue. Only the people that know me really well will probably get this. But we're going to say The White Velveteen Rabbit's Journey to the Center of the Earth.
I like it.
Okay. I mean, it's totally weird. I get it.
I love it.
Yeah. So.
So what we're saying is, if you want to get to know why that would be your autobiography title, you have to get to know you as a person.
Yes.
So join the coalitions, meet Amy, and then learn about this autobiography title.
Yeah, to be determined after I retire. So it's going to be a minute if I'm writing an autobiography.
Well, thank you so much. I had a fun time. I can't wait to introduce you guys to more of my coworkers. And Amy, I can't wait to talk to you again.
Sounds good. Thank you for having me. This is fun.
Absolutely. I am here with Dr. Laura Fullenkamp, our resident doctor. Also, I think you have the longest title in the office. So Laura is our Director of Criminal Justice and Compliance. Can you tell us what that very fancy long title means?
Well, I always joke that it's all the things that nobody else wants to do. But they're things that I love very much. So as the Director of Criminal Justice and Compliance, when we talk about programming in the community, I really focus on any of the programs that involve the criminal justice population. That's kind of where my career began, and I really loved working with that population. But then I also just get the wonderful job of overseeing the quality of all of our programs in the county, but also whether or not our agencies are kind of following along with the rules and the guidelines of our contracts. And so in a nutshell, that's what I do here.
I think sometimes compliance can get a little bit of a bad rap. So can you kind of give us, I know you talked about the fact that you kind of hold the agencies to a quality standard, but in the kind of threshold of compliance, can you kind of talk about what that means in the scope of your work?
Absolutely. So with compliance, in addition to really looking at some of the quality aspects, I also oversee any of our audits that we do. So for the state of Ohio, we are mandated to conduct audits annually for our agencies to make sure that they're following any of the state rules. We kind of trickles down to us, and we're the ones who oversee whether or not they're doing those state guidelines, but then also any of our contract guidelines. So for instance, we contract with our agencies to serve Wood County residents with our levy dollars. So one of the things that we would look for in an audit is whether or not they're using those funds for people that actually are Wood County residents. And so part of my job is to go through and make sure that clinically they're doing what they're supposed to be doing, but contractually they also are. We, as an office, do the audit process. That we certainly have other people that are involved in that in different elements, but I help to oversee that then. I
think I've said this like a million times since I've seen Amanda, but kind of opening up the curtain to the land of Oz and seeing behind the scenes of the podcast. I don't entirely know how everybody's going to fall, like, you know, the episode, who's going to go first, and etc. But because you brought up the levy, I think it's a good time to say either again or for the first time that we will be on the ballot in November. So we will have lots of conversations, and really, we hope that the people that listen to the podcast and that follow us get a good idea before the levy of the quality that we really do hold all our providers accountable for, and all of the great services that the taxpayers help us to be able to provide for our whole community. So we've talked, kind of danced around it, I guess I'll say. And I know that we have 9 providers that are fantastic and unique in their own right. But can you kind of tell the people generally, like a 50,000 foot view of the type of data that you would typically collect?
Absolutely. So we have a few goals with the data that we collect. We are looking at, of course, monitoring quality, so making sure that people are receiving really wonderful services that are going to work for them. But our other role at the board is really to do community planning. So a piece of the data that we also collect is really looking at what are the needs of the people that we're serving to make sure that we also do have the services available for them. So some of the data that we look for then is how many people are currently being served, making sure that we actually have adequate staffing levels for the people that are needing the services. We look at the wait list times for the folks that are requesting the services. But then we also really look at how well are those services being performed. So we call those outcome measures, where we actually look at different kind of goals for each of the programs. And within there, then we're looking at how many people are being served, definitely, but also are they receiving benefit from that? So we set a goal for a certain percentage that are either being discharged successfully. We might be setting goals for different things that they're achieving while they're in there. I know in substance abuse services in particular, one of the really big things is retaining folks for a certain amount of time. The research just shows that if people are in treatment for 90 days or longer, they just tend to do better. And so that's one of the things that we look at. So we try to make our outcomes really research-based so that we know that the things that are proven to work are the things that we're really aiming for.
I'm going to test my memory here, but I mentioned our 9 providers, so just so we're clear about that. That's ARC, the Addiction Response Collaborative here in the county, the Cocoon, which is our domestic violence and sexual violence shelter here in the county, CRC, the Children's Resource Center, the ESC, the Educational Services Center, Harbor, Ohio Guidestone, Namiwood County, Unison, Zeph, think that's all of them. Okay.
I think you made it.
And of those agencies, do they all report outcomes to you?
Yes. Yep. So each agency that we fund reports outcomes. Certainly some of them look a little bit different depending on what type of service they're performing, because we have some that are treatment, some that are recovery oriented, some that are prevention, but they all have goals based off of exactly what they're doing.
Nice. Earlier when I recorded, I referred to Amy as the captain of prevention. So I'm still like working out the whole like naval who falls where. So we'll just call you the captain of outcomes.
Okay.
You did a fantastic job talking about why we measure outcomes and why it's important. But I wanted to ask, any way that we can dispel maybe that we're just collecting negative data, or maybe sometimes outcomes are poor? Is there anything that you want to say regarding that?
Yeah, absolutely. So I think that is one of the harder parts of my role, is that people are often a little bit concerned to give us data because there is a fear that we'll uncover things that won't be good, but that isn't typically the case. Like a lot of times we're either able to then offer technical assistance if there are things that are slightly below, or what's more often the case is we really get to see the successes that are happening in our community. And it's one of my favorite parts of this role, is being able to see the really great services that are available in Wood County and be able to hear the success stories of the people that are involved and the really great things that are happening in their lives from the services that they're getting. And so it's a really wonderful part of this. And so rarely are we actually having to do the punitive side of outcomes and saying, oh, we're going to cut this program because the outcomes are poor. More often than not, we're just able to really see the successes and highlight them for our folks.
So I really kind of want to shift gears, because you are involved in so many things. Sometimes it's hard to comprehend even within the four walls of our office. Is there anything that you would like the podcast listeners to be on the lookout for, or anything Dr. Camp that maybe even I didn't know that you were up to?
I think that there's a lot of kind of unique projects that are coming down the pipe for Wood County, and we're really excited about a lot of them. One of them is the Guardianship Board. So guardianship is something that is historically really fallen to either attorneys that are trying their best to help in addition to their typical workload, or family members, which can really get to be a stressful situation for those family members involved when they're trying to make decisions on behalf of their loved ones who aren't really very thrilled with the decisions that are having to be made. So we have a guardianship board that we're working towards starting in collaboration with Hancock County and Ottawa County. And so we're really looking forward to that coming to fruition in the spring, ideally. But then there's actually a board of individuals that are going to be employed through the 3 counties that are in the field, are trained, that can actually act as the guardian for a larger amount of people. And so that's a really exciting project. Another one has been one of my favorite projects, because I don't often get to work in prevention when we talk about criminal justice. Usually somebody's already kind of experienced some kind of a stressful interaction with an individual who's then ended up in the jail before we really are able to intercede. And so with our behavioral intervention program that we've been working on, we're actually looking at having services in place, especially for kiddos, as we're noticing some of those warning signs that they might be kind of trending towards that path of being involved in the criminal justice system, and really getting some services in place. And so that's been a really exciting one that we've been working in collaboration with our juvenile detention center. So if they already are in the system, we can help, but also our schools, so that if they are still on the pathway towards detention, that we can intervene a little bit more quickly. So I think those are our 2 most exciting kind of unique projects going on right now.
Oh, definitely.
Yes.
And if anybody listening is like, I haven't heard about this, you are correct. So really, first I want to say, well, that's why, we sat and we talked about this podcast about as a way, to give the information that we do day to day really to the outside world. But as we, navigate through these projects, there will certainly be, marketing materials that go out, and we'll have discussions about what these projects actually look like for the larger community. So I don't want any of our listeners to be like, this sounds fantastic, but where has it been?
More information to come on how people can receive the help if they need it.
Yes.
Absolutely, as it all.
Always. So I have one last question for you, and this has, I thought that, learning about everyone's jobs would be the coolest part of this podcast, and it certainly is. But this, last icebreaker question has been really my favorite because everyone has just been all across the board in terms of, what their answer is. So if you hypothetically had your own autobiography, what would you title it?
So when I was thinking about this, I had some wonderful motivation and a cup that Kaylee had actually made for me. And my autobiography would actually be, I'm silently making a spreadsheet for that. Because I feel like no matter what part of my job, there's always a spreadsheet to be made. And that's one of my favorite parts of my little bit of OCD that I tend to gravitate towards.
I would say you excel at Excel.
Thank you.
Well, I just want to thank you for coming and hanging out with me and being able to break down the huge pot that is your job for me and everybody listening. And I can't wait till we're back and we can talk about some more stuff. But I also want to end with all of the things that Laura's talked about. So we have remind me what CAP stands for.
The Community Assessment and Plan.
The Community Assessment and Plan, and the outcomes data that Laura makes this beautiful report that's so easy to understand and color-coded. Those things are available on our website. There is just a tab that says Community Reports, and you can just click there. I have the pleasure of joining Miss Julie Launstein. Julie is our Director of Finance, and if you call her the Finance Director, that is wrong.
No, I'll answer to just about anything. The money lady, the director of finance, the finance director, the evil one.
So can you tell us a little bit about what you do kind of from a 50,000-foot view that isn't all numbers and letters and mathematic equations I don't understand?
Okay, so yes, 50,000-foot view. I take care of the funding. I make sure that it's all tracked, spent appropriately for whatever source of funding we received it. Make sure we use it for what its intended purpose is, and in a thoughtful and, what's the word I'm looking for? Thoughtful and...
Fiscally responsible.
Fiscally responsible, yes, that's a great word.
So, I'm not going to ask you to go into the very nitty-gritty of it, but can you kind of tell the listeners generally what types of funding we receive, like our buckets?
Our funding comes in a couple different ways, and the bulk of it comes through the Ohio Mental Health and Addiction Services. So the state gets funding from the feds and the general revenue, and then other tax-based services. So take for instance the casinos. They get a portion of funding for the casino that then gets pushed down to us as an ADAMHS Board to spend on prevention-related activities and treatment related to gambling. So that's just one example. And they allocate the funding to us based mostly on population, and then that funding is pushed out to us quarterly. And then we have to track every dollar they send us for each appropriate bucket, whether it's state or federal, and what the purpose is for each dollar. And then from there, I have to code everything and keep track of it all so I know at the end of the year how much we spent in each area. The other way we get funding is through grant-based funding, which again generally comes through the department at the state, but occasionally there's opportunities for us to apply for funding through other entities. Mm-hmm. And the biggest portion of funding we get is local dollars. The Wood County taxpayers have been incredibly generous in their support of our local levies, and the bulk of our funding is then local dollars, which can be used in a more broader based services in order to meet all the systems of care.
Mm-hmm. Can you talk a little bit about, this is not to pull back the curtain too much on the podcast, this is not a question that's on the sheet that I made for you, but could you, just because we talked about local dollars, could you just kind of talk a little bit about our relationship with the Wood County Auditor and kind of how that relationship works between us?
Yeah, absolutely. So all of our funding runs through the treasurer's office at the county and the Wood County auditor. So we have a second set or a third set of eyes, maybe even you want to say, on everything we spend to make sure it's appropriate and documented for the purpose intended. But yeah, so they cut all of our checks for us, or if they even cut checks anymore in this world, we get our electronic fund transfers come through the county treasurer and or the auditor's office.
Cool. And I have to give you the biggest compliment in the world, because I can watch your brain work, and Julie can pull out numbers that from 5 years ago down to the cent, and we're like, yep, that's right, Julie. So outside of your brain, I think that one of the big questions that I had when I was starting this podcast and kind of thinking about how the community would react and what they would want to know if they could be in a room with Julie and ask her questions is, how do we really keep track of our spending? What does that look like inside these four walls?
A lot of Excel sheets and a lot of codes, coding things, so alphabet soup, if you will. Sometimes I throw some numbers in there just for fun, because we operate on different fiscal years. We have the calendar year, which the county auditor's office and the Board of County Commissioners operate under, and then we have the state fiscal year that runs from July 1st through June 30th, which is the way the bulk of our funding is distributed. And then on top of that, we also have federal funds that run from October through September. And occasionally you get an odd grant out there that runs even a little bit different than that. Mm-hmm. My worst nightmare was adding a fourth fiscal year to it, which was a grant that ran from April to March. Completely outside of anything else I would be looking to do.
Right. So you mentioned it before, and we'll talk about it a lot in future episodes of the podcast, and I'm sure I'll have you back specifically to talk about it with me. But this is a levy year for us, so the taxpayers will see us on the ballot. So can you talk a little bit about some of the programs that our incredibly generous taxpayers help fund?
Yeah, absolutely. The taxpayers actually in Wood County help to fund the entire system of care in one way or another. There are always things that come up that we either don't have enough available federal funds for, or that services are difficult to find because of funding situations. I know housing tends to be an area that people really struggle with if they're dealing with mental health issues, chronic SPMI, if that's the right way to say that. Mm-hmm. And also recovery services and supports. And so those local tax dollars are incredibly important to assist us in rounding out our entire system of care to make sure that we're hitting all those buckets, the intervention and the treatment, recovery, and I think there's one more. Prevention. Prevention's a really important one. And a lot of our prevention is funded with local dollars. We have one of the most robust prevention, and I'm sure you'll be speaking with Amy and Amanda about that more in the future.
I was joking with Amanda. I referred to Amy as the captain of prevention. Yeah. So we're keeping a naval theme on this podcast. So once I figure out the naval hierarchy, I'll tell the listeners how we all fall. One of the things that I really want to make sure that we highlight too is that we do have fantastic taxpayers that work really, really diligently with us to maintain the system of care. But we also have regional dollars. Just kind of Amanda and I have referred to this as looking through the land of Oz when you pull back the curtain. So our dominant priority as a board is to help our Wood County clients, but should someone in Wood County find themselves in any of our sister counties, we do have ways to help take care of those people. So it really is a full continuum here in the county.
Absolutely. In and out of the county.
Yes. Wherever you are, we will find a way to help you. Yeah. And Julie will be on the phone, and she will... So one last fun question is, I told everyone I really wanted the listeners of this podcast to get to know us as people outside of, the jobs that we have. And so if you had your own autobiography, what would you title it?
I think I would call it Don't Spill the Beans. We get called bean counters for a reason.
Oh.
But, it's so important to keep all those buckets in order.
Oh, yeah.
That, just in general in life, I think Don't Spill the Beans would pretty much sum it up.
I love that. I want the listeners to know that we just ended the year, right? So we had closeouts, and you were like a busy bee all throughout December. And Julie has the office next to mine where we record this podcast. And I always know, because I can hear the adding machine clicking next door. I just want to say thank you for all the things you do, for hanging out with me. I'm sure you will be back. We'll be talking about the levy upcoming.
Absolutely.
So thank you so much.
Thank you.
Brittany Fackler. You are our HR/accounts manager here at the board. So can you tell our lovely listeners what exactly that means?
Sure. So basically I am in charge of the accounts receivables and the accounts payables, and also the human resource tasks that we have here at the board office.
You do so much. But mostly, like you said, you are the billing lady. So can you talk, I know that sometimes there's a bit of confusion because we're a quasi-government entity. So can you talk a little bit about how we work together with the county versus how we might differ from them?
Sure. So we work with the county a lot on a regular basis for our bills that we pay here at the board office, and then also for any insurance or HR type stuff. But we are on our own. We do have the auditor's office. They hold our funds for us. So anything that we pay out or pay in has to go through them. But we have our own office. We're not at the courthouse or a county building, but we work hand in hand with the auditor's office and the commissioner's office. So we're quasi, but we have a lot of the same. We have our own handbook, so we have different policies than the county employees too.
I was just thinking that we were talking just in our staff meeting recently about how many types of insurance we have to have. So it's funny that you bring that up because that's what the county. But you have been working here for almost 18 years. In September, it'll be your 18th anniversary. So can you talk a little bit about how it feels for you personally to watch our continuum of care like change and grow and become what we know it is now?
Sure. So I've seen a lot of people come and go, agency, name, titles, change locations, but it's been exciting to see, for example, like the crisis stabilization unit. That was like a word that we heard in the beginning, that I heard, hey, we're going to have this. We're going to try to get this. We're going to do this. And now here we have a crisis stabilization unit. So it's been exciting and really neat to see it grow. Even the programs, we have so many more now than we ever did before. But yeah, it's been a fast, almost 20 years it seems like. But yeah.
I think it must be so cool because I have things that you made like at the very beginning, and just to be able to like see things through your lens has been really, really cool. And I hope that one day I celebrate my 20th anniversary here.
Yeah, it's went fast, but then also some of the years have been kind of slow too.
Oh yeah.
But overall, it's like I blinked and here we are.
So I have one last question for you, and it happens to be my favorite because everyone has been like, I mean, The Office. We've all been across the board in terms of our answers. But if you had your own autobiography, what would you title it?
True perspective.
I like it. I like it a lot. Well, I just want to thank you for coming in and hanging out with me and telling me, all about us in the county. And you do, I feel like I keep saying it to everybody, but you do so much. So I thank you for, your time and being, the best billing person ever, from your marketing person to you.
Thank you, I appreciate it.
I am here with Catherine Shackleton, our relative Fix-It Felix Jr. Your real title is Executive Assistant here at the board. So can you give me a super broad definition of what that actually means?
So I can break it down into two. General office functions, which are generating correspondence, scheduling, supplies, ordering mail, those types of things. And board management, which is member contact information, communicating meeting agendas, packets, dates, times, and taking minutes.
I've made this joke with everyone that's been in here that they weren't allowed to say doer of all things. And we all do a lot of things, but I feel like you have the most umbrella, this is a general thing I do, but here's the 15 things that go under it type of thing. So one of the really big things that you do here is work on the contracts between us and our provider agencies. So can you talk a little bit about the how and the why that we do that exactly?
So it involves a lot of people. So ORC 340.032 requires boards to have a community-based continuum of care and then lists essential elements of that need to be included. The board's powers and duties include implementing working agreements, which we do with social service agencies that we call provider agencies. So we do this through contracting. Contracts are developed with the prosecutor's office, approved by the board through a resolution. It's a yearly process. We call it the allocation season. So agencies submit proposals for funding. The executive director and the directors evaluate the requests against community assessment and plan and funding expectations, revenue expectations. Recommendations are presented to the committees for input before moving on to full board for approval via resolution and a contract.
Clear, concise, perfect and to the point.
And all over the place.
No.
Yeah.
So when we've talked a lot about the board, and again, I think I said this in Amanda's, but kind of taking the magic out of the podcast because I don't know which way the interviews are going to fall and who goes where. And we've talked a lot about the board, and as you said, you do board member management, and really we get to see the board a couple times a month. So can you talk about the monthly meetings that we hold here?
So we have committees and full board. Committees are informational for the board. It's a chance for them to ask any questions about whatever topics are listed on the agenda. We develop the agenda, we send it out for approval, and then it becomes the agenda. It would be like if we're doing a contract, we would present that to the program committee. Here's what we want to contract for, what services. They have a chance to ask questions. Hey, do we have a history of this program? How are they doing? Those kinds of things. They recommend, yes, let's send it on to finance, which is another committee, and finance determines if we have the funding for it. The full board gets together and then they can approve it. They are allowed to take action on agenda items. We have a bajillion committees, but only one full board. And all of them require quorums to meet. Committees have specific membership of board members. Full board and a committee of the whole, because we do have that, require quorum of the full board.
And I do want to say, I talked a little bit about this with Amanda, but the other thing that you do is website management. And this is pertinent to this because you can find those resolutions that you were talking about right on our website. Upcoming board meetings, they are always open to the public.
You can also go into where they're listed and request to be added to the notification email that is sent out the week prior with the agenda attached.
Perfect. So the last thing that I have to ask for you is a little bit of a weird one, I know, but I just wanted people to be able to get to know Catherine as well as the executive assistant here. So if you had your own autobiography, what would the title be?
I titled it Chaos Coordinator. So from the outside looking in, it seems like a lot of parts and pieces that don't really make sense. And then you have the executive assistant, or chaos coordinator, who makes them make sense. I put them together in an understandable way.
Absolutely. And you are brilliant at it. This office does not function without Catherine. You just had a week off. Yeah, you just had a week off, and we were all like, where is Catherine? Like, what are we supposed to do?
Yeah.
Well, thank you. I just want to thank you for, like, hanging out with me and talking about what the board does. And I know that we got, like, a very broad view of all the things that you get to do. But I think that this will really help people understand, like, the contract. I said in my intro, you know, we don't provide services, so that's why I wanted to talk to you about how we contract to get those services to people. So thank you again.
You're welcome.
So I am here with Kaden, and I am super excited to talk to you. I don't know how our other coworkers are going to feel about that when they listen to this podcast. I didn't say that to anybody else. So Kaden is our macro intern and has been with us for the last 4-ish months.
Yeah, something like that.
And you'll be with us throughout August of this year.
Mm-hmm.
So can you tell me, you have like the most fascinating role because you just get to do like all of the things and work with all of us all the time. So can you maybe highlight some of the things you do or what your role is as our macro intern for this year?
Yeah, absolutely. So my role as a macro level intern is really to support the staff in any way that I can. And that's not in the usual way that you would think for an intern. It's not like the daily intern work. So macro is more of a systemic thing.
Mm-hmm.
So I get to support through meetings, doing research, really truly supporting the staff and all of the projects that they're doing, including the creation of my own.
I am, and I think I speak for all of the staff when I say I'm like amazed by your research capability, all of the things that you're building around us. It's fantastic.
I appreciate that.
So one of the things that you have undertaken with us is really our view of housing. And as we learned from Amanda when I talked to her, really our priorities are based in the CAP. And when we were doing our community plan for the year, we decided that housing was a huge need in our community. So can you talk about your perspective on housing, the things you've been doing here related to that? Anything you'd like to say about housing, I think is what I'm getting at.
Absolutely. So in starting this, I wasn't expecting it to be as big as it has become in doing this research. I really just went into it trying to have a better understanding of what housing looks like in Bowling Green as a whole. And in doing so, I was able to discover that there are a lot of gaps in what we have available and a lot of lack of affordable housing and good housing in Bowling Green as a whole, and even in Wood County. And so in doing that, I discovered that we really have a need for permanent supportive housing. There are a lot of people in our community in Wood County as a whole who are struggling to find housing that truly supports them, especially people who struggle with mental health and disabilities and anything along the lines of that. So in doing this research, I've discovered this really important need, and my goal is just to really push that out into the community and have them understand the support that's needed here.
And I can't think of anybody better to do that. You are so fantastically connected here in Wood County, and it's like amazing to watch you walk into a room and not know anybody and then walk out of a room and be like, I got 15 emails. And so because you're so connected here in Wood County, is there anything that you would like people to be on the lookout for, whether if it's things you have going on campus because you are a student, a master's student over at BG, or with the work you're doing here? I just want to know all of the cool things that Kaden is doing.
So I appreciate that. So I think one of the biggest things that I would say in regards to people being on the lookout is Bowling Green, BGSU, the university, offers a lot of community events. And so trying to figure out a way to bridge the gap between BGSU as a university and then Bowling Green as a community is really essential to me in my work this year. Finding ways to really support the community and then BGSU students and having that recognition be that we are all community members in this town is super duper essential to me. So I think being on the lookout as a student for events in the community and then as a community member for events at BGSU is going to be one of the biggest ways we can really help bridge this gap in our community.
I love that. I can't wait. I feel like I'm going to have you on the podcast like a year from now, and you're just going to be like, look at all the things that I've done. So to end with you, I keep using this metaphor, I think because Amanda used it, but this whole podcast is kind of like a look behind the curtain at Oz. So I really wanted to give the listeners a chance to get to know us as people alongside our work. So if you had an autobiography, what would you title it?
Oh, that's such a good question. I think I would title it "Spare Me the Details." I think that really encompasses that there's a lot of things that people experience behind closed doors, and I think that in a lot of conversations, people don't really want the details of things. So I think it would kind of be a conundrum to have a spare me the details, but then it goes into detail of my life and the experiences that I've had. So I think spare me the details would be the title.
I love that so much. And I just want to say thank you for working with us as our macro intern. For you have helped me so much in marketing, and I stand in awe of all of the things that especially your Excel spreadsheets. Kaden is months out, and but yeah, so thank you for hanging out with me, for telling the people all the amazing work you're doing, and I can't wait to have you back.
Absolutely, thank you for having me.